public naming of people infected with COVID in Bangkok. What do you think about this? Is it an effective measurement in the fight against COVID?
Is your damn queen with the most fantastic girl you've ever seen? You can describe the scene. Spread a sail to where you've never been before.
Hi guys, hope you're doing fine. If you're new to this channel, I'm George, Chai Thai, and you're on My Thai 24. Let's jump right into it. Last Monday evening, I heard a public announcement on loudspeakers in the community just on the opposite of my condo in Bangkok, naming a person infected with COVID and his family. I've recorded about half of it, but I think it's enough to get an impression. Just listen to it, check the subs, names are beeped out.
ได้ติดเชื้อโควิดนะคะขณะนี้กักตัวอยู่ในบ้านนะคะ
So, what do you think about it? Please let me know in the comment section. Honestly, I thought, wow, kind of extreme, publicly naming a person infected with COVID. And I think most people in the West would think like this first. But at the same time, this public announcement made me a bit worried, because now I know the virus is just very close. I have a 2-year-old son and family, which makes me a bit more sensitive to this COVID issue. It's not only the fear of getting sick from COVID, but also the fear of being separated from my little son, because in Thailand, there's a mandatory quarantine in hospital for people infected with COVID. They have to isolate from everybody, also from their family. I've talked about this public naming with quite a few Thai people, and all of them said that this is a good and effective measurement in the fight against COVID. None of them was worried about the privacy of the infected person, so it seems like for them, the health of the other people of the community is more important than the privacy of this infected person. Honestly, with regard of effectiveness, I kind of had to agree with them, because obviously the person who is infected with COVID will go nowhere and stay home, because everybody knows he's infected and that he has to stay home until the ambulance picks him up. And other people of the community will keep distance to him and his family, and therefore the likelihood that this person spreads the disease will be reduced significantly. Now, some of you might say this is medieval or backwards, but this is a judgment from a Western lens. You have to keep in mind that measurements against COVID have to be adjusted to the local realities in each country, and trade-offs have to be made in the fight against this pandemic, not only in Thailand but also in the West. Just think of how many businesses and livelihoods have been destroyed in the West, and people are not able or not allowed to visit critical ill loved ones in hospitals. Actually, both much more severe measurements than only violating privacy. Moreover, and very importantly, Thailand has done quite well in the fight against the pandemic up to December 2020. Much better than most Western countries. So the measurements they have applied must have been effective for quite some time. Okay, some of you might say the low number of cases in Thailand were only the official numbers, and testing was quite on a small scale compared to many Western countries. And the real numbers must have been much higher. And I kind of understand your doubts, because I was also very skeptical of these low numbers, also due to the fact that Thailand was the #1 tourist destination of China, and also because the first lockdown came quite late in March 2020. But on the other hand, in Thailand, people started wearing masks as soon as January 2020, and health scans were applied at airports also quite early. Moreover, the first lockdown was really strict and took quite some time. And a 2 weeks mandatory quarantine was put into place for people arriving from abroad. And in 2020, and I was in Thailand the whole 2020, I did not know anybody who had COVID-19, and I also did not know anybody who knew anybody who had COVID-19. And there were no stories of filled up hospital beds and of people who get not treated. All in all, life got back to pretty normal later in 2020 in many places in Thailand. People even went to pubs again, to discos, to concerts, and enjoyed life. So quite different to many people in the West, right? So the real numbers in Thailand also must have been quite low. And they must have done something right in Thailand in the fight against COVID, right? I also know quite a lot of people, particularly from the West, who do not understand this mandatory quarantine in hospitals in Thailand. But I understand it because I think the leaders of Thailand, they know their people, they know their country, they know the reality of life and living conditions of many people in Thailand. And as a matter of fact, there are still many people living from hand to mouth who quite likely would not quarantine for 2 weeks at home, particularly if they have no or only mild symptoms. Moreover, isolating effectively at home would be just impossible for many people, as they live closely together with other people in Bangkok, often in densely populated areas, and it is very common that 3 generations live under one roof. So the disease would spread pretty rapidly if there was no mandatory quarantine in hospitals and no other harsh measurements like public naming of infected people and publishing their timelines on the news or on the internet. Some of you might ask what timeline is in this context. On the timeline, a person infected with COVID-19 has to specify all places he had been to during the last 2 weeks before he started to have symptoms. As far as I know, usually there are no names on these timelines which are published on the news and on the internet. Only age, gender, and the occupation. With these timelines, in combination with CCTV cameras, very often people who had met the infected person can be traced down quickly, and thus the spread of the disease can be contained. By the way, some of these timelines must have been quite embarrassing. For example, a man in his 70s revealed in his timeline that every other day during the last 2 weeks, that almost every other day during the last 2 weeks, he had been to a karaoke bar with hostesses. There are quite a few Thai guys who jokingly say that they are more afraid of the timeline than of getting sick from COVID. And therefore, they even more make sure that they do not get infected. Now, COVID-19 has escalated as never before in Thailand. Also partly because the Thai government is hesitant in placing strict lockdowns and measurements. Also due to the fact that the impact of them would be disastrous for many Thai people who have already been struggling hard for a long time. It's kind of a dilemma. However, infection rates are increasing rapidly, faster than ever before, because the more contagious British virus variant has entered Thailand, apparently from Cambodia. Therefore, local lockdowns in provinces with high infection rates could happen soon. Now coming back to my initial question, what do you think about public naming of people infected with COVID? Is it an effective measurement in the fight against COVID? And what do you think about mandatory quarantine of people infected with COVID and publishing their timelines on the news and on the internet? Let me know in the comment section. Hope to get many comments. Hope to start a discussion there. It would be great. By the way, I have many awesome videos coming up soon. So hit like and subscribe and make sure you don't miss them. Thank you very much for watching, and I catch you on the next one. Bye.